So the case essentially looks at a 64-year-old woman who develops a rapidly growing lesion on the lower part of her eyelid that develops numbness, tingling, and finally presents to her dermatologist for evaluation. So this lesion is subsequently biopsied. It's proven to be a poorly differentiated aggressive squamous cell carcinoma. The diameter of the lesion is about 8 millimeters, and so it's in an anatomically challenging area for management. The patient also has a history of hypertension, hyperlipidemia, and rheumatoid arthritis, which again would make some people question whether or not this is a candidate to get systemic therapy with immunotherapy like cemiplimab. Based on the clinical presentation where this lady has numbness and tingling associated with the lesion, it makes you very concerned that she's got perineural invasion. And so you want to get a good imaging study. I would probably get an MRI of her head and neck, predominantly her head, to make sure that there's no perineural tracking, where you can actually see tumor thickening along the entire course of the nerve. Many of these lesions can grow very quickly, and you can have extension of tumor even to the base of the skull or into the orbit. So you really want to have a good assessment of exactly how deep is this lesion. If on that imaging you realize that this is really just not a simple lesion located in a challenging area, you would then go on to image the rest of this patient to make sure she didn't have any distant disease. You can either do CAT scans of the chest, abdomen, and pelvis. Sometimes we do PET scans, but with the new economic sanctions that are in place, it's very challenging to get a PET scan approved. If a patient had commercial insurance, it's a little bit easier. But again, most of these patients are older, and so they're going to have Medicare as their primary. And so getting a PET scan, you have to really think about whether you want it or not, for the simple reason that Medicare patients are covered for 4 PET scans in the course of their lifetime. So you got to use them wisely because you only get 4. If you want more than 4, you really have to argue it, and there's a chance that it could be denied, and then the patient subsequently gets stuck with the bill. Sometimes it's more challenging to treat young patients because they've got 50,000 things they want to do, and to get them to actually make appointments and come in and make their health a priority, because young patients don't think that they should be sick. You know, older patients have accepted the fact that things are starting to slow down. Most of these patients are retired, and so they're more than happy to come and have their issues taken care of. And I usually don't have much of a compliance issue with my older patients.